Mr. President, I've chosen again to forego my spotlight on the parole board's ongoing release of cold-blooded killers, rapists, dangerous child sexual predators, as well as other violent criminals across the Commonwealth into our neighborhoods. Today, I want to again focus on the issues that we're having with getting the vaccine into the arm of our citizens. The largest and most populated city in Virginia that enjoys a number of tourists that more than doubles the entire state's population has not transitioned to Phase 1B. Not because they're not ready, not because there aren't enough doses available for them to do so. In fact, Virginia Beach has the infrastructure and supplies ready and waiting on the governor. 2 weeks ago, the Surgeon General told the states and governors, move quickly to other priority groups if your demand isn't there in 1A. Go to 1B, go to 1C. The most important thing is to get the inoculations into the arms of our citizens. Yet again, Virginia Beach sits in Phase 1, waiting on the governor, waiting on the administration. The city of Virginia Beach has developed a portal, and it's been tested to facilitate the registration process for those residents eligible under Phase 1B and beyond. They moved resources from other activities to do so because they see it as a priority. The city manager has declared as soon as VDH authorizes the transition to 1B, they're ready to go. Why, you ask, Mr. President? Because the city of Virginia Beach, with its 500,000 residents and 20 million visitors a year, see vaccinating our population as a priority. So why is the largest city in Virginia still in 1A? We have everything we need to administer the vaccine. The numbers on the VDH website would suggest there's currently almost 600,000 doses distributed to the state, ready to be used, that have yet to go into the arm of a citizen. HHS Secretary Alex Azar said every vaccine dose sitting in a warehouse rather than going into the arm could mean one more death that could have been avoided. People are entitled to their own opinions, but not their own facts. I continue to cite or provide my sources. While I know some would like to blame the president for his administration's failure, it is plainly obvious that 47 other states have done this better than we have. They've achieved their positive results under the exact same president. The CDC reported at 10 a.m. this morning that we're still number 48 in getting vaccines into the arms of our citizens. That's what we need, results, not excuses. Mr. President, the federal government is supplying the states with vaccines, and it's duly the state's responsibilities to distribute the vaccine and get it into the arms of the citizens. The states that do not administer the supply they are given, the federal government is going to divert future supplies to the states that will. The states that can efficiently and effectively administer the vaccines will get and receive additional doses. Mr. President, have we not received an additional vaccine supply since the 13th of January because we already have 583,349 doses still waiting to go in the arms of our citizens? Back on December 13th, Virginia received its first batch of doses. But it wasn't until 3 weeks later the governor appointed Dr. Avula to manage and lead the vaccination efforts. I liken this to deciding you need a football coach after the third quarter ends. Instead of wasting time and efforts trying to defend the administration's poor performance, can we not come together, recognize the importance of this problem, and just work on it collaboratively to fix it? Surely the senators serving the peninsulas have heard, like I have, from their local leaders and city managers with their frustrations. Simply put, the success of an efficient rollout benefits all Virginians, and that's what I want. 27 health districts across the Commonwealth are in Phase 1B. Virginia Beach and 7 others are still in 1A. And not because we're not prepared, not because we don't have the infrastructure, not because we don't have the vaccines, because we're waiting on direction from the governor and the administration to move from Phase 1A to Phase 1B. So I ask you, Mr. President, I ask the governor, why? What are we waiting on? This is a problem we need to fix through open communications and real action by leaders. Now is not the time for excuses. Now is the time for action. Now is the time for true leadership. Mr. President, please tell the governor, our governor, I'm available to meet and discuss how to solve this problem anytime, any place, because this is my priority. Thank you.